we will talk about baking soda. There are lots of stories about baking soda, that it alkalinizes our body and it fights against cancer and it prevents cancer, but such statements usually not true, and we will clear what is true and what we really know about baking soda. It is also known as sodium bicarbonate, and we know for sure that it has antacid property and it's really effective against heartburn and dyspepsia. And we have strong evidence that in 84% of cases it relieves dyspepsia within 15 minutes. Actually, it's really good action because it has strong antacid effect, and baking soda usually costs cheap, much more cheap than classical antacids. And now there is question, what is dosage? Dosage usually is 1 teaspoon dissolved in 1 glass of water, and intake according to symptoms, or 2 or 3 times per day. But try to not exceed 2 weeks, because after 2 weeks it's already long-term intake of baking soda and it can have some serious health effects. Another strong evidence we have about baking soda or sodium bicarbonate is it improves dental hygiene. Baking soda has antibacterial and antimicrobial action. Especially it has antimicrobial action towards Streptococcus mutans, and Streptococcus mutans is responsible in many cases about on dental plaque, and dental plaque is serious problem in stomatology. So it can improve dental plaque, it can improve oral hygiene and oral ulcers. That's why baking soda is important. How we can use it? We can add some baking soda on toothpaste. It's very simple usage, or use as mouthwash with same dosage, 1 teaspoon of baking soda dissolved in 1 glass of water. Also, sodium bicarbonate has antidiarrheal action because it causes absorption of water into intestines, so it has antidiarrheal action and it's effective. Actually, it's good trick if person suffers from diarrhea, but sometimes we don't need to stop diarrhea. It depends on cases. And specific usage of baking soda is chronic kidney disease. We have some studies about it, that it slows down kidney damage, but there is no strong evidences, and it's very specific situation, and you can't use or you can prescribe baking soda to prevent or to cure any kidney disease. Now let's say what is long-term health risks of baking soda, because some people in taking it daily, it can cause metabolic alkalosis. Metabolic alkalosis, yes, it's alkalizing of body, but we should remember that our blood pH is strongly controlled within 7.35 to 7.45 pH. So below this and after this, it's already serious health risk for person, and it can be lethal also. That's why we have very strict range for pH, and any trying to alkalize our body beyond these borders is not correct, and it can be lethal. So it's not correct to try such thing. And on the other hand, yes, you can try to alkalize your body with baking soda, but if you intake small amount of baking soda, our body will neutralize it. So that's not problem for our body, and our pH will be in the same range and not important alkalizing effect. But if you intake baking soda regularly and high amount, of course it will alkaline our body and metabolic alkalosis will develop, and it's already serious health problem for our body. So it's not recommended. And On the other hand, we say that we need alkalinize our body and our blood because we need to prevent or cure any cancer. It's not correct also, because we have opposite studies and opposite results in many studies, that even breast cancers, for example, and colon cancers creates alkalinizing environment around them, because they need alkaline around them to develop. So you think that you will stop cancer to alkalinize your body, and you can get opposite effect. You can create favorable environment for them, so you can get opposite effect. That's why it's not recommended to try alkalinize your body, because you may get worse effect. Another long-term health effect of natrium sodium bicarbonate usage is hypertension, because baking soda contains lots of sodium, and sodium causes hypertension. So for person who has risk of hypertension or have hypertension, should not intake baking soda regularly. And calcium depletion is important also, because our body neutralizes sodium bicarbonate with calcium, and intaking it in long term can cause calcium depletion. And calcium depletion is harmful not only for our bones, but also for our muscles and for blood vessels also, and it can be one cause of hypertension also. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.